Um, Hi, if you are here, we are here to have a discussion. Few best questions to answers to give your patients and then their family members. Sometimes it's very difficult answering family members. The hello, each and everyone to it. So today's discussion I'm going to have. Today's discussion is going to be on certain challenging questions that family members and patients relatives tend to ask. So you can be on duty and then they hand over a case to you and you are supposed to continue management. And then the next thing, family members will come and be asking you questions here and there. So today's discussion is going to be about, primarily, it's going to be about um, certain questions that patients' relatives tend to ask and the best answers to give them. Because the answer you give them is either going to lift their spirits, bring more funds to support the patients, or it's going to drive all of them away. And then uh, they will conclude that the doctor probably has pronounced uh, their patients or their family members um, the doctor probably has pronounced the family members or uh, told them that he's never going to get better. So all these things, the best answer to give them would determine the outcome of the treatment. And sometimes to when you work, when you gain certain experiences, you tend to know the next question the relative is going to ask, and then you give them the right answer. Okay. So the first question is, um, when will my patient or when will my family member be discharged? So maybe the daughter will come or the son will come and say, "Oh, when will my mother be discharged?" So the best answer you give them is that, "Oh, it depends on how well they respond to treatment. We will review the progress every day and then discharge them as soon as they get better. So and then that is very safer. So you tell them that um, it all depends on how they respond to treatment, and then you discharge them. You make sure that um, you discharge them as soon as they get better, and then that is medically safe. Medically safe. If you put it that way, they will understand. They will understand. So some questions too they can post is they can ask is, why isn't my father getting better? They can ask you, why isn't my father getting better, or why isn't my son getting better? So the right answer to give them is that, oh, recovery is a process, and then and it varies from person to person. So, but your son or your daughter is going to get better. We are going to be monitoring her very closely, and then we'll make sure that the best treatment is given, and then with time, she's going to get better and discharged home. So, if you tell them this, they obviously will be okay. Then the next question is The next question is when maybe the nurse, when the relative or of the patient happens to be a health worker, so they can go like, um, can you give a stronger medication, or they can say, can't you increase the dose or something? Can't you give them a stronger medication that will make them feel better quicker? So sometimes they feel that the stronger the medication or the higher the dose, the better. So you just let them know that the best treatment isn't always about medication. So you tell them that healing starts from the mind, and the best treatment is not always about medication. We choose that um, both sides are safe for their condition. Okay, so you let them know that the medicine you are going to give and then the dose you are giving is safe for their condition. So when they ask you to give a higher dose, don't just get angry or don't just tell them that you and I, who knows best, who has gone to school. No, you tell them that for their condition, this dose or this medicine is better and is very effective. And then the best treatment is not always about medication. So, so the difficult part is when they tell you, is their family members going to die? So then they tell you, doctor, is my father going to die? That is very difficult answer. So when they tell you, is your father going to die or something like that, at this stage it's difficult to say whether to say yes. So don't say yes and don't say no. If you say yes, it means you're giving them assurance that no matter what, they'll be alive. And if you say no, it means you are pronouncing them dead before anything else. So at this stage, it is very difficult to predict with certainty. So you tell them that we are doing everything medically possible, and then we are putting in appropriate measures, um, and then we'll keep you informed in case there is any changes. So if you put it this way, you haven't said yes and you haven't said no. So if you answer it this way, you haven't said yes, you haven't said no, but you are keeping them, you are leaving them to decide on what to interpret from what you said. So you told them that at this stage it is difficult to predict the outcome. You understand? Uh-huh. But we are doing everything medically possible to help save your mother or your father. And then we will keep you informed or we will update you when things change, when there is a change in her situation. So if you put it like this, you haven't said yes, you haven't said no either. So that's one way to do it. Um, so another question they ask is, how much longer will the treatment take? How much longer will the treatment take? So this is obviously going to come from somebody who is very impatient, and obviously, so the best answer is that the duration depends on how the patient responds. Some patients improve quickly, while others need more time to heal, or The duration depends on how patients respond to treatment. Some patients get better quickly on this medication, while other patients need time to get better. So, if you put it this way, it will mean that it wouldn't be like you said, oh, in 3 days' time, they'll be fine. You are just letting them know that others take this medication and they get better in few days, whilst others spend several days and get better later. Uh-huh. Okay, so the next question is going to come from families that think they know so much, or family that have financial constraints. So they say, why are you ordering so many tests? And I've experienced that before. And apparently, you realize that the tests you actually they are pushing you not to order will turn out to be what is going to um, help with the treatment to get the right diagnosis. So they'll tell you, why are you ordering so many tests? So the best answer you give them is that each test will help us to understand the condition better, and then it will guide us towards the safest and the most effective treatment. So, and especially when you came to take one sample and you are coming to take another sample. If you came to take one blood sample and then you are coming to prick patients again for another blood sample, that's the question they will ask you, obviously. And then the next question is that, why can't my father eat? Or why can't my relative eat? So you tell them that, oh, certain conditions require um, or certain procedures. With certain procedures, we advise patients not to eat, and that is quite safer. And then once everything is done, she can proceed to eat. And then when the time is when it is time for him to eat, we'll just let you know. Or you can say um, certain conditions and certain procedures are time sensitive and time bound. And so sometimes certain medications interfere with food. And so when you eat, or when your relative eats that food, it's going to affect the outcome of the treatment. So another scary part is, why is my so they say, why is my relative still sleeping? Why he has been sleeping till like 4 hours now, he has been sleeping. So you tell them that they may be resting because of illness, or because of their illness, medications, and then the body also needs time to heal. So, and then healing is also a gradual process. So that is why they are still sleeping. So while sleeping, they'll get better with time. Um, so another question is the one that recently happened at Community 25, 22, in Accra, when a patient's relative was asked to leave and then he ended up physically assaulting the nurse. So, so the question goes like, why can't I stay with my relative at this time? Why can't I stay with my relative at this time? And so, especially when um, visiting time is over. So you say, oh, we appreciate your concern, but per the hospital policy helps us to provide safe care to protect the patient's privacy and to reduce the risk of infection. And then the next question is, why is another doctor coming to review my relative? Why not the same old doctor that reviewed my relative? So the best answer to give is some conditions benefit from input from specialists. Their expertise helps us to provide the best possible care. Or you can also say that it's always best for it's always best to get a second opinion from another medical personnel, and or it's best for another person to also assess to enhance the treatment or to give better treatment outcome. And then the next question says, I googled this and this is what the internet is saying. So the internet says it's something else. So you Google, you diagnose a patient, and then the family members come to tell you that this is what the internet is saying. Okay, this is what Google is saying. So you tell them that online information can be helpful. Online information, it can be helpful, but it may not apply to every patient. We are basing our decision on your relative's specific symptoms and examination findings with test results. You understand? So while you tell them that online information, even though it can be helpful, but it may not apply to everybody. Online information, though it's helpful, or GPT, though it might be helpful, but it does not apply to everybody. With regards to your relative's case, we are putting together signs and symptoms with medical examination findings and laboratory test results. That is why we have arrived at this specific diagnosis. Okay. So the next question is for the nurses. It goes like, why is the doctor not here yet? So many patients ask this question, why is the doctor not here yet? So the best answer to give, the doctor is attending to other patients, including emergencies. Okay, they will review your relative as soon as possible. So once you say this, the person will calm down. So I think there are many more. Okay, so this one can be a little bit challenging, especially when relatives tell you, can we stop the medication now? Or can we stop the medication now that my relative look better? So you tell them that it's important to complete the treatment, the prescribed treatment, unless the healthcare team advises otherwise, to prevent complications or relapse. So you hear sometimes they'll tell you they don't want their family members to be on oxygen. Sometimes they'll tell you, why is my relative in a catheter? We won't allow you to pass catheter. So in such a situation, what answer do you think will be best? How do you think we should put this? When family members are telling you, as for them, they don't want, especially in Ghana, they don't want you to pass rubber. They call it rubber. They don't want you to pass a catheter. So, what would be the best answer to give? What would be the best answer to give? I'll be waiting for your thoughts, how you will answer this question. Let's say you want to pass a catheter, okay? And then the relatives are saying that we don't want anybody to be in a, we don't want our relative to be in a catheter. So what will be the best answer to give? You can put your thoughts in the comment section. Okay. So the next question is, how much will all this cost? Family relatives can ask you, how much do you think all this will cost? Or how much will the treatment cost? So the right or the best answer to give is, I understand your concern. The billing office can provide the most accurate estimate based on the care and treatment required. So over there you will shift the pressure from yourself to the billing office, because you can't come and quote price. You quote 20,000 or 2,000, and then the family members will say, uh, you said everything will be 3,000, but when you went now it is 5,000. So that is it. What will be the best answer to give when they say, can you hurry up? Let's say family members tend to give you pressure to hurry up. So you tell them that, I understand you are worried, but we are working as quickly as possible while making sure that every step is done safely. Okay, so the next question is definitely a Ghanaian type of question, because they do that a lot. So they say, can I give the patient herbal medicine? Can I give the patient a herbal medicine? Or can I give my relative a herbal medication? We heard this particular medication works perfectly. So can I give my relative this herbal medication? So you tell them, please let us know what you are considering before giving anything. Some herbal products can interfere with medicine or worsen certain conditions. So it means you haven't said that herbal medication is neither good nor bad, but you're just saying that it might interfere with the medication you are giving. So it's better to let us know when you're about to give. So, ladies and gentlemen, these are a few things I brought out for us to look at. So, if you have any comments, you can put in a comment section, and then the best way to go about things, you can share your story with us in the comment section, and then I'll be glad to assist, or I'll be glad to read it out. All right. We've come to the end of today's discussion. Have a blessed day. Take care. Bye.